Hey guys, welcome back to your channel Dr. Battisi, and I'm your dentist Dr. Jasmine. So today we are discussing about the problems with their solutions which almost each and every person who has opened their new setup will be experiencing in the initial 1 to 2 years of their dental clinic practice. I have been through all this, and this is really very important so that by sharing my experiences you guys can benefit. And if you're opening your practice, you know which way, if you're going this way, what things you need to take care of. So guys, this is basically into two parts. The problems, the one is the patient related, the second is the clinic related. First, the patient related is like bringing patients to the clinic. Patient नहीं है, footfall नहीं है, there is cutthroat competition, all these words we have heard a lot. So this takes time, and honestly, no matter how much we get into the digital world, I still believe that word of mouth has really immense value, and it's just pure gold. And it takes time to build that network, but once done, it's like an automation. Then patients are coming, but the second problem is the patients consult conversion jisko bolte hain. It's not the it's a business kind of a term, but you can say like patient consultation. So it's like in that way you have to upgrade, and it takes time with experience to what words to speak, how to consult, what not to say, what to say. But this is like 50, we can just give ourselves the best, and it's always the patient's choice, and it should be like that. And the third is patient retention. Patient is coming, patient is getting converted, but the old patients should keep coming to us. They should be like, we should be their family dentist now. So on that, we have to keep on growing and upgrading ourselves. Do not forget our roots, values, ethics, like on which our base and foundation of the dental practice of we as a dentist is based upon. And that is why in every video of mine you will share a dentist prayer before any video is started. So please, and I sometimes do read once or twice a week the dentist prayer, just to remind who are we and what exactly we are doing. A lot of you might have heard the word window shopping. There is window shopping in dentistry also, and call shopping. Patients are like, सिर्फ चार्जेस बता दो, सिर्फ एक्सरे करवाना है, नहीं नहीं आप रेंज बता दीजिए ना, सिर्फ चार्जेस बता दो. अरे यू हैव टू अंडरस्टैंड ईच टूथ ऑफ अ पर्सन इज डिफरेंट, ईच टू केसेस आर डिफरेंट. अगर आपको दांतों की सफाई की चार्जेस बता देंगे, हाउ डू वी नो द कैलकुलस इज 1 और ट्रिपल प्लस, and how much stains it is, how is it fluorosis, is it amelogenesis imperfecta, that is why the stains are not going, like what is the cause. There is just pimple on my above my tooth, and it's not a pimple, it's a pus, it's an abscess, needs an x-ray, and you have a huge infection at the bottom of the like at the apex. Who is going to tell that over a call? People don't understand, and don't entertain them then, because it's not a window shopping or a call shopping. And we are not like dentistry is like you have to act, you have to see. We can just guide for the treatment, but we can just explain for the treatment online, but we need to sit, we need to discuss face to face. We have to see your mouth before we speak or write anything or diagnose anything. Sometimes, for example, they will say, for example, if your consultation is 200 and it includes x-ray, for example, so they will say, आपका तो 200 का कंसल्टेशन है, मैंने एक्सरे तो करवाया ही नहीं, तो 100 रुपये दे दूँ. हाउ अ पेशेंट कैन जज दैट द डिजिटल एक्सरे वी आर टेकिंग इज for 100, not 150, or even not 200? Because nowadays, even if people get films in a dental clinic, that is costing people 150 rupees for per film, and for digital x-ray you are saying 100 rupees. Like, how can a patient decide? And they are not supposed to decide, honestly. Yes, they have the right to ask, why are you doing, why this charge costs this much, but they cannot decide like in what clinic what charges should be, because each case is different. No two clinics, just one, just by the side to another, two together clinics cannot be same, two dentists cannot be same. Please understand that two patient cannot be same. So, and you know what happens sometimes, patient, if you do not have a dental assistant, no one is there and you are just sitting, patient comes, we consult, okay, just look, and we fill the form, everything is done, patient has not paid yet, but he has got the idea of the charges, you know. And he will be like, just give me 5 minutes, I'm coming down from the ATM, just give me 5 minutes, I have a meeting, I have to just see off somebody, I have to, you know, keep this there, I just keep get my keys, and I just come back in 10 minutes, and those 10 minutes are not going to come back in 10 decades. So please have a proper system of your clinic. I'm not saying like it's very necessary to keep a dental assistant, but that gives a very professional outlook on your clinic, and it's a proper way. You know, you fill the form, you give 200 consultation, then everything is proceeded. By giving the consultation, patient is understood everything, but it's his or her choice about the treatment. If he wants second, third, final 100, 1500 opinion, it's his or her choice. But by giving that consultation, it looks professional, you know, there is a proper way. If you have to meet a doctor, there is a way to go to that. Now patients are like, for example, guys, I'm just taking examples, it's an all hypothetically I'm saying, like खुले पैसे नहीं हैं. If for example your treatment total is 1500, but you know you gave some you know आपने कम कर दिया कुछ, you gave some discounts and you said like 1350 rupees is your final that you have to pay. So he will be paying 1300. Now that 50 rupees, patient might think, you know, 50 रुपए है छोड़ देंगे, but from your end you have already did 150 rupees deduction. So write that 50 rupees pending in front of that patient name in your record book wherever you are keeping it, because that is really must. In future if he comes, you have to, you know, give a gentle reminder for that. And if he's not coming, like that was the last visit, after 1 week, 10 days, whenever that is little suitable, the patient is comfortable, we do not have to be a like call center callers, we do not have to spam patients, but we have to be very fair enough to the patients, to us also, not just to the patients, to us. Now the patients are like, you know, guarantee and warranty, you know, just tell them very frankly, we are not gods. Even the, if you can destroy your teeth which was given naturally by god, how do you expect us to replace, no matter what best material we put, no matter it's 99% identical to the natural, it cannot be 100%, no matter where the science goes, it cannot be 100%, nature cannot be replicated. So tell them 99%, 95%, whatever, depending on the case, the prognosis is, just tell them fairly that there is always 1% chance, because they should know that if they do not keep their mouth clean, if they do not get the scaling done, if they do not get the hygiene maintained, this going to fail. And it's not doctor's responsibility for that, but it's our responsibility that we should mention this, we should train them the right brushing technique, that is on our part. But there is no guarantee warranty when a the heart stent, yeah, or anything rod is placed in your body or anywhere, or some major procedure is done, then you do not there is a form that you sign at the hospital, right? So you do not ask them, there is a guarantee for that. Of course you just need to know ki what I'm investing into, how much, you know, how long it's going to stay. So things stays long if they're taken care of. So please do not ask for guarantee or warranty, although there are few warranties or guarantees in dental lab work, that is on part of the dental lab and not the dentist work. It's like the dental lab what has given their work, it's their, you know, maybe marketing strategy or something like that. But if they have a card number, if something is, you know, we can contact them and they do it, like there is, it's not a spam. So from a doctor, please do not ask for a guarantee or warranty. Do you ask the big brands of food, like, is there a guarantee I will not get fat, or this has this much value? Do you even check the nutritional, the ingredients? Have you ever questioned them? If you would have, honestly, we would have a very good food industry. Chalo, coming back. So you know, sometimes patients also give discounts on their own from us, they decide their charges on their own, give discounts on their own. So you have to decide which person, like there is everything which is like limited, guys. If those are the person who have given your BDS fee, MDS fee, have built your careers, have guided you in any way, then they are allowed for your free treatment. Honestly, I wouldn't charge my parents because they have given my BDS fee. But yes, I'm going to charge my other family members or relatives. Maybe it's very discounted, maybe it's very basic, but yes, I'm going to do. And these people, these patients come and tell the doctors their charges. Like, Doctor Saab itne mein kar do, bas. Now, what that bus means. So, you have to maintain that line always. And guys, during festivals, especially November to February, or during extreme summers, winters, patient flow will be less. People go to their hometowns, and that is amazing. That is good to know. Even you can visit if you have one. But yes, we have to be sure that during festivals and like those times, patients do, like, footfall is less for sure. And it's not just in one clinic, it's like overall every, this field is affected for sure. And always tell and ask the patient before doing any treatment procedure or before making any changes in your treatment. Even if you're doing this, if you are doing, like, you have to do a filling, but you realize when you open the tooth that it's going to be an IPC, then you have to tell the patient, because the patient is later going to might counter question you that I did not tell you to do this. पहले ही ठीक था, आपने ये क्यों करा? So from the patient point of view, he's thinking that you want money, that is why you're doing it on your own. So you have to always tell and ask the patient before doing anything, if you're changing like the procedure or something. Consent form, always fill it, always take it. There is no, just take it. On the website www.dr.battisi.com, there is collections, and in those collections I have in Hindi and English given in that collection a very good consent form. It has majorly covered everything. You can go through that. And never ever compromise on your sterilization process or procedure, no matter what. Do not touch or operate cases or emergencies that you might not able to manage. Always take guidance from MDS specialist or people who are having more experience, be it BDS, anybody who knows more than you, who is expert of that case. Do consult them, no matter if you're getting not no profit even of 1 rupee. And sometimes in some cases you have to give money from your own pocket. That is really important in the initial years, and you have to maintain this even if you grow big, because patient trusted us, he visited or she visited us. So it's our responsibility, no matter what, that treatment is completed and done in the right way. Do awareness camps for awareness, be it any place, multinational companies, schools, any corporate area, wherever you can. People will definitely Google, and they have a lot of questions, and that is good, because you know the right thing to answer, like the right answer to every question of theirs, and you have to give that. So you have to prepare, we should know our basics. So you are there for the right information. So no matter if people are googling, because then they can differentiate, अरे यार गूगल पे तो ये पढ़ा था या कहीं और ये पढ़ा था, but the doctor makes sense, yes, the doctor is right. So they feel it. And honestly, if you can put a camera in the surgery room, at least there should always be a camera. If not, it's okay, have a third person or an assistant or anybody in the room, because sometimes the doctor and patient can blame the doctor, that the female can blame the male doctor, or sometimes anything can happen there. So if there is camera, it's really good. Now guys, coming back to the clinic part, this was all the patient part. So there can be a huge losses, like the clinic board can fail. Suppose you thought that you were going to open a dental clinic, and then you thought you might add a skin or a physician or a other hair specialist to it. So then the everything changes. The decorum, how the clinic is made, is changing. The boards you designed is changing. Everything is changing. So you have to be very clear. And I would like to mention, please do see, there is 5 episodes of the series how to open or set up your dental practice. Please do watch that. Then there must always be a washroom which should be cleaned, no matter you have a washroom at your own place or somebody the patient can go, or it's a complexes that markets washroom, it should be cleaned. Lift should be there, especially if it's above first floor. Your dental clinic is there always. Wheelchair, and because the lift can have a wheelchair, and the if we are going some clear aligners, Invisalign, so there is a huge setup. If we call like the scanner and everything, it's a huge thing which comes up, so it's very difficult for the doctors or their supporters to carry it. There should be a lift. If on rent, please listen to this carefully. If on rent, please have 4 to 6 months of backup of rent, please. Make sure all branches, pedo, ortho, oral surgeon, prostho, perio, endo, MDR, whoever it is, you have two doctors to consult to. Each you have two doctors. Sometimes one doctor is not available and you have an emergency case, and there is a case and you have to do it on the day itself or the tomorrow. You must have two doctors. So have a good contact. Patient ko jahan convenient lagega, he or she will go there. So we have to provide all the services we can. Surgery or the procedure room should be at the last. Waiting area is different. Procedure room should be at the last. It's not a peek-in room. Like, it can be a transparent room where everything can be seen because there's nothing to hide. But it's not some place like whole family can sit and we are operating. Not the way. Not the way. There can be scammers, chanda wale, false organization people will come. You have to be aware of them. Rent person, if it's on rent, make sure to get a rent agreement beforehand, be it 3 years, 5 years, 10 years, because usually 5% rent is increased every year, and on an average 10 to 15% is increased every 3 year. I guess it's 15% every 3 years. So it's like we can have a little bit khitpit sometimes with the rent people. It can be due to rent agreement or due to things how operating in the rent area. So please be clear with that. No matter how good we are or they are, if it's documented, it's really good and professional your careers in life. Battery, please, either inverter or generator, have a power backup, because it's really difficult and especially in summers, if the patient is sitting, we are doing something long procedure and the light went off and you do not know when it's going to come back, be it 15 minutes, 20 minutes, it's like patient is wasting their time, we are wasting their time, and we are all sweating, so it's really very messy. And if you do not have that, make sure to appoint your patients accordingly depending on the circumstances of your place, of your where the clinic is situated. So guys, these was the basic overview of the problems and with their solutions that you're going to face. I'm quite sure this will guide you and prevent you from the mistakes that we usually do, or mistakes that happen, or things that happen on the way to the amazing dental practice journey. So happy practicing and see you guys in the next video. This is Dr. Battisi signing off. Take care. Bye bye.